and I call the member for Macquarie.
Thank you, Deputy Speaker, and I thank the member for Cunningham for bringing this motion. It is something that so many of us deal with on a day-to-day basis in our offices, working hard to support people who, for whom the NDIS is still not the perfect system, although we all acknowledge what a difference it makes to people when it works well. It's been a priority for the Albanese government in the last 6 months to really try and get to the bottom of what the barriers have been in the NDIS that have made it one of the biggest challenges that my office has experienced in the past 6 years. There's many things we've done, and one of them is install new leadership. And really, with a view, it's not just the leaders, it's what you task them to do, and that is to put people at the heart of the system so that people with disability are the reason that we're here and the systems are designed to work around them. Another key priority has been around reducing the number of people who are in hospitals, people with disability who are essentially trapped in hospitals. They're medically fit, but they haven't been able to get out of hospital. For example, there were 1,400 people with a disability stuck in hospitals in August, instead of being discharged once they were fit. Now, we all know that that time in hospital results in care being delivered in completely the wrong setting, at a higher cost, and it blocks people from being able to use those beds. It costs the health system hundreds of millions of dollars each year, and that's just the Commonwealth cost, let alone what the states pay. The NDIA has been implementing our initial plan with some early successes. In October, the NDIS Minister announced 50 hospital liaison officers nationally are now working with states and territories to, as he describes it, wrangle support and accommodation teams so that things are actually moving. In addition, there are 54 dedicated specialist hospital discharge planners, and their job is they've got greater powers to be able to get things done at a local level. The consequence of this is that we've reduced the average wait times for an NDIS participant to leave hospital from 160 days to just 39. And there are also more than 300 people not on that list that we had in August. That sort of 1,400 kind of stuck their list. So we're getting better outcomes for patients. So that's one area we've focused on. Another is around the backlog of cases before the AAT. It's horrific how people have had to go through massive legal hoops just to get a package that they deserve. The AAT work has also made a difference to the backlog. Under the previous government, there'd been a 400% increase in the number of cases being referred to the AAT, and we had a legacy of 4,500 cases on backlog, people who were waiting for their day in court. Now, we commenced an independent expert review process to address the poor experience of the NDIS participants who had a dispute, and we're getting on top of that backlog. Over 2,000 inherited legacy cases have now been resolved. That will be 2,000 families whose lives are a whole lot better. So that's another area we've focused on. We've also funded 380 new positions in the NDIA to get better and faster planning decisions for people with a disability, which supports their families, their carers, their providers, and all the workers. So there are a number of things that we've done, but there is clearly more to do, and the root and branch look that we will take, review we'll take, is going to make a difference. And I commend groups like the group I work with very closely, Kindship, who did a survey of their members to tell me all the things that were still needing to be done. And we know there's still a long list of issues that are not resolved in our first 6 months. Things that have been plaguing the system for nearly a decade. I look forward to working through those issues with my constituents. I have a huge belief in the ability of the National Disability Insurance Scheme to be able to transform people's lives, to allow older parents of people with a disability to sleep at night, knowing that there's a plan in place for their child's future. There's so much we can do, and I know there's goodwill in this place to get it done and to support the workers who make this system a viable system.